Thanks for this.
My pleasure.
One thing making it harder to effectively fight the crisis, there's no consensus of opinion on how to treat those who are addicted. Most doctors support using methadone to ease withdrawal, but some are resisting, saying it only trades one problem for another. One doctor in Nova Scotia dug her heels in, and officials cut her off from treating opioid patients altogether. Angela MacIvor has more.
Typically, when someone seeks treatment for opioid addiction, they have two options: a pricey stay in private rehab or a free admission in a public detox facility. In Nova Scotia, opioid users wait weeks to get into a public detox unit and usually only stay 5 to 7 days. They're given methadone, a liquid medication that's also an opioid. It helps stave off the painful effects of withdrawal. Dr. Kathy Felderhoff runs one of those detox units, but she refuses to prescribe methadone because she doesn't believe one opioid should be treated with another.
I think in a way we've created a medical monster because what it's done is taken the spotlight off of some of the root causes.
When the Nova Scotia Health Authority discovered Dr. Felderhoff was prescribing Valium and codeine instead of methadone, the entire facility was cut off from treating opioid patients. The Health Authority will only say Felderhoff's protocol was not accepted practice. Felderhoff admits her method isn't championed by everyone.
The after effects, possibly once you're discharged, may be more painful, but at least they're stepping down with codeine Valium to nothing.
Shane Nelson tried to detox without methadone a few times. It didn't work. For the last 5 years, he's been taking it every day to fight his cravings. He says methadone saved his life.
I don't think of it any different as getting Champix to stop smoking than having to take a drink every morning to stop being a junkie.
Nelson agrees with Dr. Felderhoff on one thing. They would both like to see detox stays extended to at least a month. Felderhoff says follow-up care also needs to be improved.
I think the more options that the individual can choose from is more healthy. I think as soon as somebody tries to control a program and says this is how it has to happen, that's not healthy.
Although Dr. Felderhoff can no longer treat opioid patients, she still works at the detox unit. Staff are only permitted to treat people addicted to alcohol and other drugs. Angela MacIvor, CBC News, Pictou, Nova Scotia.